Hi everybody, this is Venk with Always on EM. I'm at ACEP in Las Vegas and I'm excited to meet Kendra and hear about her work. Kendra, do you mind sharing a little bit about who you are and take us through your work today?
Yes. Hi, everyone. Thanks so much for tuning in. My name's Kendra Jackson. I'm a peds emergency physician at Johns Hopkins in Baltimore, Maryland. This is my fellowship project at Carolina's Medical Center as a peds emergency medicine fellow. I started HIV screening in our adult and peds emergency department. Kind of before I was a resident, we actually weren't allowed to do HIV testing in the emergency department. There was a lot of concerns about follow-up, if patients were going to be testing positive, who was going to follow up those results. Once I became a resident, we started incorporating that in the general consent to do HIV testing with symptomatic STD screening. As a peds emergency medicine fellow, I received a grant from Focus. It's the public health arm of Gilead that supports U.S. Preventative Task Force and CDC recommendations for HIV screening. And so we started screening for HIV, opt-out routine HIV screening for people who are 15 to 65. We incorporated that in our nursing triage, and this was what it looks like for our nurses. So for patients who are between 15 and 65, haven't had an HIV test in the past year, this opt-out screening will pop up in their workflow, and they'll say, hey, we're going to do HIV screening today. Do you have any questions for the provider? And if they don't refuse, we order the test at that time. And then we have a social worker who follows up all of our HIV results. They do the disclosure, they get their patient to the first HIV appointment, Ubering them, helping them with their Medicaid paperwork, their Ryan White paperwork. As you can imagine, we had some challenges, especially with our pediatric nurses. North Carolina is an abstinence-only education state for sexual health for adolescents, and so a lot of our peds nurses were very uncomfortable with discussing HIV with our pediatric patients. And so we created a easy button for them that if they had a physiological, a psychological, philosophical, or a religious reason why they did not want to do HIV testing, we created a easy button for them, questions for a provider, and it made it a provider-based BPA for HIV opt-out screening. And so we started about 2 years ago, had about 40 HIV tests per month, and now we're over 500 HIV tests. We've diagnosed several adolescents with acute HIV, and for our adolescent population, 13 to 21, 30% of them have been asymptomatic.
Nice.
Our first teenager was 16 and came in with constipation.
Wow.
Viral load of 3 million. We got him into treatment, and about 3 months ago he had a follow-up appointment and his viral load is 20, and he's doing great. We're really proud of this work, incorporating this for adolescents because they don't see their primary care doctors, and so
Right.
I'm the first line of defense, and I love that we can do public health work in the emergency department and make a difference for our community.
That's really fantastic. And I'm not familiar with this arena at all. So, very naive question. The legalities surrounding the education, does that apply to healthcare workers outside of the classroom, or are those laws only the classroom? Or
Sure. So every state has a different kind of disclosure laws about HIV. So in North Carolina, where this work is being done, you have to offer verbal opt-out screening. No physical consent needs to be signed,
okay.
but the patient does need to have an opportunity to refuse the test and know that an HIV test is being done. And so as long as we say, hey, we're doing an HIV test today, and they have an opportunity to say no thanks, we can order that test no problem. We have Epic, and so MyChart will automatically update patients with their HIV results, in addition to our disclosure social worker following up with them. And we have a two-prong system where we have an HIV with confirmation, so that they will say, hey, you had an abnormal results, you have a confirmation test that's going to be coming back tomorrow. Someone's going to call you tomorrow to discuss it, and that automatically is in their discharge papers. So that's North Carolina, and hopefully in the future, I think consenting for or opting out for HIV testing. We don't let patients opt out of a CBC when we think it's medically indicated, or diabetes screening. So I think that part of the opt-out does help continue the stigmatization of HIV, but we're going to work with what we've got now, and hopefully in the future things will be different.
That makes sense. Kendra, this is awesome. Thank you so much for sharing this.
Yeah,
I hope you have a great
thanks.
time here in Vegas.
Thank you.